Hi, my name is Paul Henderson from 21C, and today I'm going to demonstrate to you our JSNA map application. JSNA stands for Joint Strategic Needs Assessment, which is an exercise that needs to be undertaken by all PCTs, that's Commissioners of Healthcare in the UK, and their County Council counterparts. The idea behind the exercise is that as health and social care organisations, they need to understand the likely uptake of services for planning, monitoring and forecasting purposes. Thus, on a national basis, we've defined a set of 150 indicators of lifestyle, population, demography, which are going to help us decide where the hotspots for health and social care are going to be in the country in the next few years, and what sorts of things are going to make the general public consume more or less health and social care services. In this screen you'll see we have a Bing map. The mapping is driven by SQL Server 2008 Release 2 OLAP software, and this is a Silverlight website. It forms part of a MOS 2010 portal which provides other business intelligence capabilities to the user community, and that will be the subject of a separate short film later. So the idea behind this application is that it enables people with just 2 or 3 clicks to look at the national picture. So in this case we're looking at total population. We can add a subsequent measure, and you'll see there are 150 measures that are in here. So we might be interested in, let's say, alcohol-related hospital admissions per 100,000 head of population. And you can see here that on a regional basis we've got 2 measures on the same map, so we can look at where there are the most densely populated areas of people who are being admitted into hospital with alcohol issues. And you can see that we have a bar chart and a line chart over the top there which plots those 2 statistics. The map is then driven by looking at particular areas of the country. So we're going to go here and we're going to look through North Yorkshire. I'm going to go down to Harrogate. And then when you get to the lowest level, you can see that what it's doing here is covering the map. Now, at this level of granularity, which is a very small postcode area of the country, we don't take this data in relation to alcohol-related admissions, but we do have the total population. So you might decide that you want to change some of these measures and go back through and pick through the list if you wanted to do that. You might also want to try and look at local points of interest. So now what I'm going to do is jump to another area of the country, and you'll see from the breadcrumb at the top here that I've now moved from the northeast to the East Midlands. I'm looking at Nottinghamshire County. I'm looking at a particular teaching area in Notts County and a postcode area at Ashfield. And you can see that I've actually decided to change the secondary measure, so I'm looking now at estimates of obesity. And therefore, as I do have data at that level, my mapping image is a little bit more rich. So you can see we have the view that we were looking at before, and now we've got this obesity data at a lower level of granularity. So then what I'm going to do is, actually this one is showing total population, so I'm just going to swap the measures over, and you can see then that it drives according to the secondary measure and shows them where the greatest prevalence of obesity is. I might then be interested in, well, okay, how am I organising my services to address this issue? So do I have general practitioners who've got a particular interest in obesity issues, and am I providing services in places where I have the highest prevalence of disease or epidemiological issues? So I'm going to put GP practices, I'm going to click done, and you can see the blue push pins here indicate where all the GP practices might be in that area. So the purpose of this exercise is to deliver a very simple user interface where 3 or 4 clicks can take you from a national picture down to a pretty low level of granularity, and you can see the data in a fairly easy to consume mapping image. Thank you.